All right, let's pop the hood on the single most important engine you will ever own. Today, we're going through a user's guide to your heart and some of its most common problems.
I mean, just stop and think about this for a second. This incredible muscle beats about 100,000 times every single day. It pumps gallons and gallons of blood through 60,000 miles of blood vessels. It works tirelessly, 24/7 for your entire life. Pretty amazing, right?
So yeah, it's no exaggeration at all to say that your heart is, without a doubt, the hardest working muscle you have. It's this personal, life-sustaining powerhouse that you carry with you every single second of the day.
Okay, so if we're going to talk about what can go wrong with this engine, we first have to understand what right looks like. So let's start with the basics, how a healthy heart is supposed to work.
At its core, a healthy heart is basically this perfect two-sided pump. You've got the blue side, that's the right side, which takes in all the oxygen-poor blood from your body and shoots it over to the lungs. At the same time, the red side, the left side, gets all that fresh, oxygen-rich blood from the lungs and pumps it out to everywhere else. It's an incredibly simple and honestly elegant design.
But what happens when things don't go so perfectly? Let's start with what I like to call plumbing problems. Think of these as issues with your engine's fuel lines, your arteries.
The main culprit here is a condition called atherosclerosis. Now, that sounds complicated, but it's really just a fancy medical term for the buildup of, well, gunk. These fatty deposits called plaque get stuck on your artery walls, and as you can imagine, that makes the pipes get narrow and hard, and that restricts blood flow.
And here's exactly what that looks like. On the left, you've got a normal, wide-open artery. Blood is just cruising through, no problem. But then look at the right. That plaque has created a serious bottleneck. You can see right away how this would start to starve the heart muscle of that vital oxygen-rich blood it needs.
So when your heart muscle isn't getting enough blood, it doesn't just stay quiet, it sends out a warning signal. That signal is called angina, which is a specific type of chest pain. The absolute best way to think about it is as your engine's check oil light. It's a clear sign that something needs your attention, and fast.
So how does this all build up to a full-blown failure? Well, you start at step 1. With a healthy heart and clear arteries. Then, over time, that plaque builds up, the artery narrows, and you get angina. That's step 2. The final stage, step 3, is when that plaque breaks open and a blood clot forms, creating a complete blockage. That, right there, is a heart attack.
All right, so we've covered the fuel lines. Now let's move on to the engine block itself, the pump. This is all about pumping power and what happens when that engine starts to fail.
You know, the term heart failure sounds absolutely terrifying, right? It makes it sound like your heart just stops. But that's actually not what it means. It's more of a chronic, long-term condition where the heart muscle gets weaker or stiffer, and it just can't pump blood as well as it used to. The engine is just losing its horsepower.
And this condition can actually change the physical shape of your heart. Just look at this comparison here. On the left, you've got a typical heart, but the one on the right, well, you can see how it's become enlarged and weakened as it struggles to do its job.
Now, this pump failure isn't just one thing. It actually comes in two main flavors. First, you've got systolic heart failure. The issue there is a pumping problem. The left ventricle is just too weak to squeeze hard enough. But then there's diastolic heart failure. That's a filling problem. The muscle is too stiff to relax and let enough blood in between beats. So two totally different mechanical problems, but they both lead to the same result, a less efficient engine. Okay, so we've covered the plumbing and the pump. What's left? The wiring. Every engine needs a good electrical system to run, and your heart is no exception. Let's talk about faulty signals.
When the heart's electrical system goes haywire, you get what's called an arrhythmia. It's a simple term for an irregular or abnormal heartbeat. Basically, the timing signals that tell the heart when to contract get all messed up, just like faulty wiring in a car.
And you can really see the difference here. On the left, that's a normal heart. See how neat and tidy those electrical pathways are? It's an orderly signal that creates a steady beat. But look at the heart on the right. It's an atrial fibrillation, a really common arrhythmia. The signals are just chaotic, firing all over the place. And this makes the heart kind of just quiver, instead of giving a good, strong pump.
And this brings us to something that is so important to understand, because a lot of people get this wrong. A heart attack is not the same thing as a cardiac arrest. A heart attack, remember, is a plumbing problem. A clog blocks an artery. Cardiac arrest, on the other hand, is a wiring problem. The electrical system malfunctions and the heart suddenly stops beating. two different events, and it's absolutely critical to know the difference. Okay, so we've gone through clogged pipes, failing pumps, and faulty wiring. I know, it can sound a little scary, but the most important part is what comes next. What can we actually do about all this? So let's get to your heart's maintenance plan. Just like with your car's engine, certain things are going to cause extra wear and tear. For your heart, we're talking about the big risk factors here. Things like high blood pressure, high cholesterol, and diabetes. Smoking is a huge one, and so are lifestyle factors, like obesity and just not moving around enough.
But here's the really good news. The preventative maintenance plan for your heart is not some big secret. It's actually pretty straightforward, but it's incredibly powerful. It all comes down to staying active, eating good food, and keeping a healthy weight. It also means managing your stress, and I can't say this enough, if you smoke, quitting is the single best thing you can do. And of course, working with your doctor to control any conditions you might have, like diabetes or high blood pressure.
So that's what it all comes down to, really. This amazing engine works nonstop, 24/7, for you. It never takes a break. The real question I want to leave you with is, what are you going to do for it